I'll be presenting this case of familial exudative vitreoretinopathy, early detection and management. FEVR defines a group of inherited retinal diseases characterized by abnormal retinal angiogenesis leading to incomplete vascularization of the peripheral retina with subsequent retinal ischemia. It shows genetic heterogeneity, variable penetrance and asymmetric presentation. Disease asymmetry is typical and variable phenotypic expressivity of retinal abnormalities may result in a unilateral case. It can be inherited as autosomal dominant, which is the most common form, or autosomal recessive or X-linked recessive disease. The pathogenesis involved that there is an abnormal angiogenesis in the periphery resulting in ischemia and ischemia leading to hypoxia, stimulating the new vascular growth, which later results in vitreoretinal traction, subretinal exudation, retinal folds, hemorrhages. And on the left, we can see these are various genes that are involved. A 6-year-old girl presented to the OPD of AIOCMTC4 Rohtak with complaints of diminution of vision in the right eye. The birth history, she was born at full term via spontaneous vaginal delivery to a 31-year-old woman with an uncomplicated pregnancy, and no oxygen had been administered during the neonatal period, no history of trauma, family history not significant, systemic examination within normal limits. The right eye had a vision of 660 and the rest anterior segment examination was normal, whereas the posterior segment examination, the right eye showed a peripheral avascular zone along with lipid exudation in the macular region. And the OCT of the right eye also shows that there is an abnormal foveal contour along with subretinal exudation, and the FFA shows there is avascular retina in certain areas, and the dye is leaking surrounding the new vascular fronts. The patient was given injection ranibizumab along with laser photocoagulation done for the avascular area and was followed up every 4 to 6 months for the first 4 to 6 weeks for the first 3 to 6 months, followed by 3 monthly for the next year. Now visual rehabilitation plays an important role. It involves early detection and amblyopia management, patch therapy, penalization in unilateral cases with amblyopia, timely refractive correction with glasses or contact lenses, low vision aids involving magnifiers, telescopic advices, electronic low vision aids, large print material and accessibility tools, educational and psychosocial support, special education support for children with low vision, counseling for the parents and family regarding chronic nature of FEVR, genetic counseling for family planning. Now DDs involve ROP, but FEVR is usually a disease in babies who are born at term. They are of healthy weight category. Norris disease, there is unlike FEVR, Norris has microphthalmia, corneal opacities, developmental delays and deafness. And in Coats disease, it is a unilateral condition more frequently seen in boys. Unlike FEVR, neovascularization and traction membranes are not seen. And in incontinentia pigmenti, there are characteristic skin lesions at birth and neurological symptoms as well. To conclude, it is an inherited vitreoretinal disease characterized by abnormal retinal vascular development leading to varying degree of ischemia. The presentation mimics the presentation of other pediatric and adult vitreoretinal disorders, and the wide variability in patient characteristics implies that the diagnosis of FEVR cannot be easily excluded based on birth weight, gestational age, age of presentation, family history, or evident laterality of disease. Accurate diagnosis of FEVR is important because the unpredictable timeline of the progression warrants lifelong monitoring. Thank you.